it's Laura Coleman Waite here at Foothills Park, and I have had a ton of questions about nerve pain this week, and I wanted to kind of explain a little bit more about the hip flexor and see if that helps clear it up a little bit. So usually you get nerve pain down one leg. Sometimes when things get super tight on me, I get nerve pain down my right side. It's usually because my other hip, my left hip, isn't working very well. So when I'm sitting, driving my car, I'm leaning and accelerating with the right foot, and that left hip comes up, and over time the pressure is more on the right side, and the hip flexor on the right side gets tighter and the left hip gets more and more out of position, and you start to feel the symptoms on the right side. That's exacerbated by people that have desk jobs and have to sit, because remember, sitting is passive hip flexion or positional hip flexion, and I'll show you that on my cool anatomy app in just a second. But your brain doesn't know the difference between this kind of, if you're jumping over a hurdle, and this. All it knows is the hip is flexed. The hip flexor is contracted. And when it does that, and it does that only on one side, then it can start to pull on the places that it attaches because it gets tight over time. So the two places it attaches are the vertebrae and then the top of the inside of the femur. So it can yank on the top of the inside of the femur, or it can yank on the vertebrae. And if it yanks on the vertebrae, then it can squish down on one side, which compresses the disc, and then the disc can squeeze out a little bit. Some people call it a bulging disc or a herniated disc or a ruptured disc if it goes on for long enough. And then that bonks into the nerve, and then you get that nerve pain. The nerve pain can go down the front of your leg, the nerve pain can go down the back of your leg. Either way, it's nerve pain, and we've got to get both hips doing the same amount of work. So I'm going to show you in just a second what that looks like, and we're going to try and balance out those hips. So we're going to stretch one side and we're going to engage the other. Be with you in a sec. Hi. Okay, so I'm using a simple chair, and we're going to stretch one side of the hip flexor and engage the other side. So I'm going to get down on the ground, and in my case I'm going to stretch the right side hip flexor, so I'm going to let it be on the ground, and I'm going to engage the left side. So I'm going to bring the left side up into the seat of the chair, and I'm going to support the outside of the ankle so this leg is totally straight, and then I'm just going to lay down. Normally, you obviously wouldn't be outside, but you'd bring your blanket down with you, you'd bring your phone down with you, you'd bring your water bottle down with you, you'd bring the remote down with you, and just turn on something to allow you to spend some time here. So I'm going to try and engage the hip flexor on this side one of two ways. I can just bring that knee in towards me to try and engage the left hip flexor, and remember it's very deep in the front of the crease of the hip. Or I can straighten out this leg, pull my toe back, tighten my quad, and I can rotate that leg back and forth and try and find the hip flexor that way. Same thing goes for the other side. So let's say I'm getting nerve pain down the left side of my leg. I'm going to try and engage my right hip. So I'm going to stretch this hip. I'm going to try and lengthen that hip flexor muscle, and I'm going to engage this side. So I can bring that knee, bring it in a little bit, and then pull it back, or straighten it out, pull the toes back, tighten the quad, and rotate back and forth. And you're trying to get the hip to move the leg. Okay, and spend an hour here, spend half an hour here, spend as much time as you possibly can to let this muscle elongate. If you're having trouble lying flat on your back, if this is not comfortable for you, then one big cause could be that hip flexor. And in this position, you allow that hip muscle to elongate one at a time. Okay, I'm going to show you the anatomy now. Hi, I'm looking at my complete anatomy app. I love this thing. So I'm going to blow this up, and I'm going to show you the hip flexor muscle. Here's half of it. This is the iliacus muscle. It lines the inside of the hip bone and comes down and attaches to the top of the inside of the femur. Its best friend is the psoas muscle, this muscle. It hangs onto the vertebrae in the low back and also comes down and attaches to the top of the inside of the femur. The two of them work to lift the leg off the ground. It's your body's primary choice to pick your leg up off the ground. When that muscle gets tight on one side, you can see how it hangs on to the vertebrae. It's going to clamp down on them, and it can cause the disc to bonk out and bonk into the nerve, and then the nerve goes down your leg and tells you something's wrong. So what we're going to do is balance it out a little bit, but I wanted to show you the motion of the hip flexor. So there's this little cool video of that muscle picking that leg up off the ground, if it'll cooperate. There! Ooh, cool. So you can see that hip flexor contract and pick that leg up off the ground. It's a big deal. So when you sit, that's the same motion as sitting, right? There you are sitting, there you are standing, there you are sitting, there you are standing. And that muscle is contracting to do that work. This muscle, the iliacus, is also helping, but the two of them come together and join at the top of the femur there to work. So if you're stuck sitting, you can see how that muscle gets shortened just from the position it's in all day. So you got to try and stand up. And then that's when lying with one leg down on the ground and one leg up at 90 degrees allows you to elongate one side at a time. So our goal is to try and figure out how to get that hip flexor to cooperate. And the other thing is that people confuse hip flexors and quads all the time. So I'm going to leave the hip flexor illuminated here, and I'm going to add some more layers of muscle. This is Complete Anatomy 2019. So here come the quads. There's a few right there. And there's the big one. This is the rectus femoris. Right next door is the hip flexor, the iliacus, and the psoas. See how close together they are? They're like half a centimeter apart. So, not quite that close. So, it's easy to get them confused, and people get confused all the time. But I always feel like when people touch the front of the outside of their hip here, they're telling me they have quad tightness. And when it goes deeper in the front of the crease of the hip, very, very deep, then it's really true hip flexor tightness. So it's a big deal, and you gotta have two of them, because you gotta have both legs picking your leg up off the ground, not just one. And if you've got just one, that's when you get on the ground and try and engage one side and release the other. Okay, this is a super long, but hopefully helpful anatomy lesson. This is Laura Coleman Weight with Just Muscles here in Foothills Park on a beautiful November day. Here's to balance, strength, and happiness, and we'll see you next time. Hi, bald eagles. Good morning. Thanks for dropping in on our workout this morning.